Good evening, Berkeley. I want to start out by thanking our dedicated city staff and essential workers, the healthcare workers who are on the front line, our nurses and doctors who are working to keep people safe and to treat those that are sick, and all the people that are supporting our healthcare system during this very difficult time, and our community that's really stepped up to not only support each other, but to support our essential workers. To provide an update on the latest number of cases in the city of Berkeley, as of 9 a.m. this morning, there are 44 lab-confirmed cases. Sadly, we had one death over a week ago of a Berkeley resident due to COVID-19. 8 are currently hospitalized. 5 are in the ICU. And of the 44 cases, 31 have recovered as of last week. And of the 752 cases as of last week that were conducted on Berkeley residents, 5.6% of those cases have tested positive. This is in contrast to the cases and deaths in Alameda County, in the state of California, and in the United States and throughout the world. In Alameda County, there are 1,149 cases and 41 deaths, and that number has increased from last week. In California, we have 31,000 cases and 1,181 deaths. And in the United States, we're up to 767 cases and 40,000 deaths. And globally, 2.4 million cases and 168,500 deaths. This is a stark reminder of the importance for us to stay home to save lives. And if you must leave, please stay at least 6 feet away from others to practice adequate physical distancing. Please cover your nose and your mouth with a cloth barrier. That is now a requirement. I'll touch on the new requirement in a minute. And please do your part to follow these important health and safety precautions. Please know that this isn't just to protect you, but it's to protect our community and to help flatten the curve. We know that people who have been infected with COVID-19 have mild or no symptoms at all. So you may not be experiencing symptoms, but you may be spreading the disease to others. So that's why it's important that we stay at home to save lives and practice adequate physical distancing. Just a brief update on actions the city and other agencies are engaged in. Our health officer has issued a new order on face coverings. On Friday, the Berkeley health officer announced that face coverings are required for essential workers and when residents leave the house, with some limited exceptions. All of us, as I've stated, are potential carriers of COVID-19, and the face coverings help reduce the spread of this airborne virus. We know that it can spread easily just through talking or breathing. And so this guidance is a critical, simple, and achievable step for us to flatten the curve. We know, unfortunately, at the present time, there is no medicine or vaccine to prevent the contracting of COVID-19. And so actions like wearing a facial covering play a critical role to allow our community to return to some form of normalcy in as safe a manner as possible. For more information on the recent order mandating face coverings, please go to the City of Berkeley's website, cityofberkeley.info/COVID-19. Also this Friday, we published a complete data set of confirmed COVID-19 cases in Berkeley on the city's open data portal. And at the end of the week, we'll be launching a dashboard to provide more specific information about COVID-19 cases in Berkeley. Please go to the City of Berkeley's website once again, cityofberkeley.info, for more information and to access this information. We are still accepting land use applications at this time, even though city offices are closed. If you go to the City of Berkeley Planning Department's website, cityofberkeley.info/planning, you can apply for land use applications, administrative use permits, landmark applications, and we are still accepting these applications at this time. As we know, the importance of maintaining connections for seniors is extremely important. With 1 month into sheltering at home, it has been difficult for all of us, but particularly harder on older adults whose support networks have been interrupted. Seniors who are living at home may be feeling isolation and loneliness, and so we are encouraging everyone to reach out to your family, reach out to your friends, reach out to neighbors who may be isolated and in need of kind words and human connection. And the Crisis Support Services of Alameda County is providing daily phone calls for homebound seniors during the COVID-19 crisis. For more information or to sign up for calls, please call 510 282 9089. And statewide, we are in desperate need of blood donations. And so the nearest Red Cross donation center is in Oakland at 6230 Claremont Avenue. You can make an appointment there, or for more information, go to redcrossblood.org. Thanks to those of you who joined us this past weekend for our weekly virtual town hall. And please save the date for our next town hall this Saturday, April 25th at 12 o'clock with our city manager, Dee Williams Ridley, and health officer, Lisa Hernandez, on the City of Berkeley's response to COVID-19. And we will be answering your questions. Stay tuned for details. And please tune in on the Berkeley Mayor Jesse Edegine YouTube page or Facebook page. So in closing, please do your part to protect your community. Stay home to save lives. Please practice physical distancing. You must wear facial coverings when you are outside, and please remember to wash your hands for at least 20 seconds. Everything you're doing is helping flatten the curve, is reducing the surge of cases in our hospitals, and is working to help keep your family and your neighbors safe. So please do what you can for the sake of yourself, your family, your neighbors, and your community. Please visit jesseedegine.com for our resource guide, and I will see you on Wednesday for our next update on the city's response to COVID-19. Thank you very much.